Okay, good morning, good afternoon, and good evening to you, depending on where you're watching me from. This is your brother and friend Chris from Teacher Chris Online Nursing and Diploma Class. So today we'll quickly be looking at something that we all know about, which I believe we all know about. We're going to be looking at the nursing care plan. So what is a nursing care plan? So a nursing care plan is simply a written document that highlights how a patient is going to be cared for. A written document that highlights how a patient is going to be cared for. So when you look at the nursing care plan, it has got two specific problems that we manage or that we look at when we're dealing with management of a patient. So the first problem is an actual problem. Then the second one is a potential problem. So what is an actual problem on the nursing care plan? So an actual problem is simply something that a patient is suffering from there and then. That is an actual problem. An example that we can give is, let's say a patient walks into your facility, then you receive this your patient, you do a checkup on them and you discover that the temperature is high. That is an indicator to show that the patient has got a fever. Let's hope you understand. I'm saying the patient has got a fever. So once you discover that that problem is there, it simply means that you're dealing with an actual problem. So therefore, it will demand immediate intervention from you, the nurse, while you are caring for that patient. Then the second problem that you look at is a potential problem. So a potential problem is simply a problem that the patient is not going through there and then, but there's a possibility that that patient may develop that problem if they are not managed appropriately during their course of stay in your hospital or facility. So others say a potential problem is not important, but I have come to discover that a potential problem is very important in the management of a patient. And an example that I usually give when we're conducting our online classes on WhatsApp is, for a patient or a baby that is just born today, you discover that once a woman is about to breastfeed the baby, they usually wash their breast. Why? Because they are trying to prevent disease-causing microorganisms from entering the body of the baby so that that child will not be exposed to infection. You understand that point? The woman is washing the breast before breastfeeding the baby so that the baby will not get sick in the end. So that is a potential problem that she's trying to prevent. So this is why a potential problem is essential in the management of a patient under the nursing care plan. So these are the two major problems that we manage when you are dealing with your patients in the facility or when you're writing the nursing care plan as a student in college. Number one, we're talking about the actual problem.